Okay, so Dr. Pillai, GPIT lead, Northlinks CCG. We're quite lucky to be part of the Yorkshire and Humber Care Record, and as a GP, I think the benefits are actually quite straightforward. We had a patient with cancer who was looked after by, the hospitals in Leeds, and for a long while we had no idea as to what the Leeds hospitals were doing for these patients until we had correspondence by way of a delayed letter into the practice. With this in place, I can actually get live information there and then. So when a patient comes in and says to me that I've just seen my oncologist and I've seen my oncologist last week and he's changed the medication, I can then effectively manage that patient in real time. Now, that's safety in terms of patient care. That's efficiency savings. Rather than me having to get my secretary to chase up the hospital and take up their time, that information's at a click of a button. So this is really a no-brainer, and this should have been in place 10 years ago because our patients actually think this is in place right now. So it comes as a surprise to them when we have to say, well, actually, no, we're in the process of developing it. So from a perspective of a clinician, safety, efficiency. So how do we get engaged in this process? I think you need to have a good understanding of what the Yorkshire and Humber Care Record is. Speak to people who have been involved in it. At a practice level, sit down amongst your partners, your practice management team, get them to share the same vision, network with other practices in the area, speak to the CCG, get in touch with your local digital roadmap committees. What I did personally is I spoke to the LDR committee, I got in touch with the lead people in the project, got a good understanding of it, got the backing of my partners. We then invited the Yorkshire and Humber Care team into the practice. They engaged with the PPG, the Patient Participation Group. We had a Patient Participation Group member who was also very interested to share her experience, having had her cancer treatment based in Leeds. So we had her signed up to the process. Then sharing that experience with other practices locally via your sort of monthly, clinician meetup sessions, by sending out newsletters, WhatsApp messages, and just showing them that actually it's quite an easy process. It's not as tedious as you think. And sending out reassuring messages about sharing information and data at scale, which I think a lot of practitioners worry about, which is probably one of the biggest hurdles that keep them away from doing this good job.